Assalamu alaikum and good afternoon. My name is Dr. Tom George. I'm the Assistant Medical Director for Neonatology at Children's Minnesota. Thank you all for being here today to learn more about the important work that has been done to address gaps in the use of pasteurized donor breast milk in the Muslim community. This is an important moment that we should celebrate, knowing we will directly impact some of the most vulnerable babies that we serve and care for in NICUs around the entire region. Thank you to mHealth Fairview, the Minnesota Milk Bank for Babies, the Minnesota Breastfeeding Coalition, and Brighter Health for your incredible partnership in this important project. And a special thank you to the Minnesota Islamic Council's leaders and scholars here today to recognize the urgency of this issue and worked with us to address the disparities that we see in hospitals across Minnesota and indeed across the country. It is my pleasure to introduce our first speaker, Dr. Mohammed Mehad, Imam from the Nuri Suleiman Mosque. Dr. Mehad.
Assalamu alaikum wa rahmatullahi wa barakatuh. We all know how important this issue, and as Imams, we are here to clarify and state the Islamic position of the milk kingship. There is some called milk kingship in Islam. And that milk kingship is a belief outlined in the Quran and Hadith. Is the belief that human milk creates a kingship between the breastfeeding woman and her non-biological nursing infant. In Surah Al-Nisa, chapter Al-Nisa, Allah subhanahu wa ta'ala says, it's haram for you to marry your mother who breastfeed you. It's haram for you to marry the milk mother who nurses you and your sisters and brothers through nursing. With donor milk, with donor human milk, many Muslim families are afraid it can also create the same milk kingship because of the Muslim families, many be hesitant about their child unknowingly marrying one of his or her milk relatives. We need an Islamic fatwa to clarify this topic for families who want to make the right decision to their babies. When Islamic law is unclear, sometimes Islamic law is unclear something, what happens? When Islamic law is unclear, Islamic scholars will gather to understand, discuss, and issue a fatwa or legal decision on a topic. It brings us great joy to know that you sought out help to solve this problem by actively involving the communities in the decision-making process and jointly designing solutions with those who are most affected. We can create a lasting impact. After our meeting with the doctors and experts on feeding, we gathered as a large group to discuss and seek clarity in the Quran and Hadith regarding this topic. We make the final fatwa after considering many factors. So we made the last fatwa after considering many factors outlined, and decide that the benefits of pasteurized donor human breast milk are so significant that all babies, particularly preterm, low birth weight, and ill babies, should be given this milk when their own mother is not available. Thank you.
Thank you very much, Dr. Mehad. I'd like to next introduce one of my partners here at Children's Minnesota, Dr. Leah Jordan.
everyone. My name is Dr. Leah Jordan. I'm a neonatologist here at Children's Minnesota. The work we are celebrating here today was made possible because of a shared commitment to equitable health outcomes for all infants in our community. As the kid experts, Children's Minnesota has a mission to champion the health needs of all children and families, which means working together to address inequities within our system and within our community. Nearly 40% of the children we care for within our hospitals at Children's Minnesota are children of color, and we know that this number is continuing to grow. We also know that access to pasteurized donor human milk in the United States and here in Minnesota is inequitable. The likelihood of an infant receiving pasteurized donor human milk depends on the state they are from, the zip code that they live in, the hospital they are born in, the color of their skin, and the language that their parents speak. For our most vulnerable infants, inequitable access to pasteurized donor human milk translates to inequitable opportunity to survive, to go home with their families, and to thrive long term. Dr. Nancy Fahim will elaborate on these medical benefits shortly. At Children's Minnesota, we care for infants from the numerous diverse communities that call Minnesota home. In Minnesota, we have more than 140,000 Muslims, including our country's largest population of Somali residents who are predominantly Muslim. While working with our local community, our local Muslim community, we have noticed that many families have been hesitant to use pasteurized donor human milk when it was medically recommended because of the concerns you just heard described by Dr. Mahad. These conversations in the NICU often felt like an impasse. We as the medical team felt strongly about the benefits of pasteurized donor human milk for protecting the life of an infant, and families felt uncertain about how to reconcile pasteurized donor human milk with their beliefs and their faith. As a physician, I can easily answer medical questions around pasteurized milk, such as how is it screened, how is it processed, and what the benefits are. But for questions of the faith, families really are looking to their own spiritual leaders and communities to be able to provide them answers about how it reconciles with their beliefs. At a time in history when our world is increasingly divided, being able to sit around a table with our partners here today and discuss this crucial and life-saving topic with compassion, with understanding, and with mutual respect was a tremendous honor. This fatwa removes barriers to accessing pasteurized donor human milk for vulnerable Muslim infants and is a monumental step towards increasing health equity in our communities. We celebrate this ruling, the babies who will survive and thrive because of it, the families who will experience peace in their decision-making, and the relationships we've formed in the process that will allow us to continue to promote equitable health outcomes in our community. Thank you. Next up, I have Dr. Nancy Fahim, a neonatologist at the University of Minnesota.
Thank you very much for everybody for being here. I'm Nancy Fahim, from neonatologist at Health Fairview and the University of Minnesota. And this is an extremely tremendous step towards taking care of our babies. And this process, it's so surprising. It came into light just about 2 to 3 months ago. I was talking with a mom, and she had a preterm baby, and she was a Somali, and she was working on pumping, but the milk was not coming in, and her baby was not tolerating formula. He was throwing it up, and he was on respiratory support, and it was clear that we needed to have a discussion. So I talked to her and offered donor milk, and she was hesitant about it. But Dr. Jordan had done some work a few months ago and realized that there was a fatwa in 2004 from the European Council that did also give some guidelines for donor milk. I talked to her about it, and you could see the light in her eyes, like, oh, this is something that I can do for my baby. And it became clear that we needed something here at home and to involve our community and to involve our scholars, our Muslim scholars and leaders. And this is just a huge change in allowing that equity. The reason we encourage human milk, and there's so many things I could say about human milk, it could take hours, but so I put it in a few sentences. Human milk is uniquely suited to the human infant's nutritional needs, with all the macronutrients and micronutrients which match the infant's requirements more closely than any other species in the world. So the macronutrients, the highest lactose content to give fuel to the brain, the carbohydrates, the fat with long-chain fatty acids to help the brain development, and with the protein that is easily digested. But what we noticed in over the last 20 and 30 years of research, that it's not only that, it's way beyond nutrition. It is a live, dynamic substance with unparalleled immunologic and anti-inflammatory properties, making the value of it unparalleled. So it is full of oligosaccharides, which help protect the human gut, antibodies, enzymes, hormones, white blood cells, cytokines, just a slew of items that help protect the newborn infant, and particularly the preterm infant. And it, again and again, systematic reviews, randomized control studies had shown that human milk saves lives. And when mom's milk is not available, using pasteurized human milk helps protect these babies against significant infections, particularly in the gut, called necrotizing enterocolitis, and it helps save lives. And because of that, many organizations that promote the well-being of children, including the American Academy of Pediatrics, the World Health Organization, the UNICEF, recommend using human milk exclusively in preterm and very low birth weight infants. And we know that moms, we encourage and we support pumping, but we know that there is difficulty in establishing that milk supply, especially when your body's sick and you're on medications and you've been through a section or blood loss. So it takes time to establish that milk. And also delaying feeds is not a good option. So it really becomes life-saving. So to allow that family-centered care and talking to the patients and respecting them, their religious beliefs and cultures, and focus on the patient, this is a huge step towards that direction. And Health Fairview and the whole healthcare community in Minnesota are dedicated to building a system where all patients are treated with dignity and respect and the highest quality of patient-centered care. And today is a major step towards that direction. I do want to recognize and everybody who brought this together within such a relatively short time, our Islamic scholars and leaders, our Department of Communication at Health Fairview, Mark Spitzak, and Shukri Jamal at Children's Hospital, Minnesota Breastfeeding Coalition, and the Minnesota Milk Bank that really have made this happen. And with that, I'd like to introduce Linda Dagg, who's the Executive Director of the Milk Bank, who with Dr. Pam Higgy have really brought this, the Milk Bank to blossom the last several years. Thank you.
We need to do a sound check here. From what I understand, it's always about the audio, right? Is that okay? Buzzing has stopped? Okay. And this one, and there's another one.
Sorry. I'm just going to try something.
Yeah.
Wondering if this... Okay, start talking, and then maybe just hold this one.
Hold this one.
Yep, and talk. Let's see.
Test. 1, 2, 3, 4, 5, 6, 7. So do I just keep holding it?
Can you do that?
I can hold.
Hang on. Let me see if we can do this.
Actually. Are we winging it? Okay. How does this sound? You can hear okay, and there's no buzzing?
Yep.
I heard, oh, there's another one. Okay. Good morning, good afternoon, good evening. How's it? It's really warm outside. That's not going to make it on the news. Okay. Okay. I'm Linda Deck, the Executive Director of the Minnesota Milk Bank for Babies. Our mission is to improve infant health outcomes by ensuring that medically vulnerable babies in Minnesota and the upper Midwest have access to safely pasteurized donor human milk when mom's milk is unavailable or in low supply. We are an accredited member of the Human Milk Banking Association of North America and licensed by the Minnesota Department of Agriculture as a food manufacturer. We meet standards for food safety and quality to dispense this milk to hospitals and to outpatients. Most of our milk goes to premature babies in the NICU and to those in special care nurseries and other inpatient units. When inpatient needs are met, we dispense to outpatient babies after they're discharged. We currently serve 33 hospital units in Minnesota, have approved more than 1,100 milk donors, and have dispensed more than 760,000 ounces of pasteurized donor milk since we started in late 2019. We have also 8 distribution sites for outpatient babies. As you heard previously, pasteurized donor milk is mostly used as a bridge or a supplement. Some moms and babies need a little more time for breastfeeding to become established or until milk supplies increase. Also, having a NICU baby can be a very stressful experience, and that can add to the challenge of producing enough milk. And this is where donor milk, pasteurized donor milk, comes in as a bridge. To briefly share about how an accredited milk bank works, milk comes in from moms who have more than what their own babies require, and they donate the excess to help other babies in need. Safety is paramount because of who this milk goes to. Sometimes babies as young as 22, 23, 24 weeks in the NICU. We screen the donors, interviewing them for their health, about their health, lifestyle, medication, supplements that they take. We test the donor's blood for 5 communicable diseases, such as HIV, syphilis, hepatitis. Donors' applications are then reviewed by a licensed provider, and once approved, the donor's milk is transported to a depot in her area or directly to the milk bank. So during processing, we pool 3 to 5 donors to even out the nutrient content and to maximize the anti-infective properties that we hear of and know of that are in human milk. Then it's pasteurized to eliminate any bacteria or viruses. A sample from every batch is processed and is tested and sent to an external lab to ensure that it is safe to dispense to these babies. You've heard about the importance of human milk for babies, particularly preemies and sick babies. Dr. Fahim shared the reasons, the medical reasons for using mom's own milk. And when it's unavailable or in low supply, pasteurized donor milk is the next best option. It is a food that can act as a medicine. So I'm thankful for this collaboration that resulted in this fatwa. Different health systems and nonprofits and the Muslim community came together to work on this. And all are contributing to disseminate this information in the public domain and in the Muslim community. Thanks to Mark Spitzak from mHealth Fairview, who had the connections to the providers and those in the Muslim community and reached out to those he thought could help. With this fatwa, Muslim families with preemies in the NICU or sick babies in the hospital can have the same access to pasteurized donor milk as others do and help them get off to the best start possible. Thank you. Next. I'd like to introduce Dr. Chip Martin Chaffy, and he is a board member from the Minnesota Breastfeeding Coalition.
I'm Dr. Chip Martin Chaffy. I'm a neonatologist and pediatric cardiologist in St. Cloud at the Heart Center and at St. Cloud Hospital. I'm also a clinical faculty member of the University of Minnesota. The Minnesota Breastfeeding Coalition and its board of directors were all in on getting this Fatwa approved. They were pivotal in helping with collaboration and conversations with healthcare providers in Minnesota and in our communities, with Muslim scholars and leaders and physicians in getting this Fatwa to happen. After those conversations, consensus has been met, and now we can offer and encourage Muslim families and their infants to use pasteurized donor breast milk for their children, just as all other children can use in this state for their health. We've already talked about breast milk and its benefits, but breast milk is not just the best milk, it's normative. It's natural feeding for infants. It doesn't just provide nutrition, though. As Dr. Fahim already mentioned, there's immunologic benefits from breastfeeding, from the antibodies that children then ingest, and it protects them from getting infected. There's the bacteria that are actually in breast milk that then populate that sterile infant gut, allowing good, healthy bacteria to grow and foster in that gut, protecting them from getting bad bacteria overgrowth. They can make them sick and give them GI issues. There's also the fatty acids that are in breast milk that help promote normal brain maturation, development, and growth. But there's more than that. Breast milk doesn't just benefit babies, it benefits moms. Moms that breastfeed or pump breast milk and bottle feed their infants are healthier. The data now shows that women that breastfeed have less hypertension and type 2 diabetes. They have less stroke events. They have less hypercholesterolemia and osteoporosis. They have less coronary events. And they have less coronary events that are fatal. They have less breast cancer, and they have less ovarian cancer. It is clear that breastfeeding women, encouraging them to breastfeed and supporting them when they are breastfeeding, is a population health home run. And it is incumbent upon all of us to support those women to make them healthier by encouraging them and letting them breastfeed. Because if women are healthier, families are healthier. If families are healthier, communities are healthier. If communities are healthier, cities are healthier. If cities are healthier, our states are healthier. And if our states are healthier, our country is healthier. The Minnesota Breastfeeding Coalition's mission is to allow normative, natural infant feeding equity to occur in all of our communities. This fatwa now allows us and invites us and encourages us to engage Muslim families and their infants in that equity. I'd like to thank everybody for being here today. It is a great day to be a Minnesotan, and not just because it's 60 degrees outside a week before Thanksgiving. Thank you very much.
What an incredible collaboration across so many different organizations, and it truly is a great day to be a Minnesotan. We now are going to have Dr. Mahad come and sign the fatwa. I'd like to invite all the esteemed Islamic colleagues and scholars to please come up, as well as all the speakers to please stand behind the Sheikh as he signs. Dr. Mahad.